and at the same time you get an admission, it can get really hectic.
Hey, champ. First night on call starts soon, huh? Gosh, you must be excited.
You betcha.
The first night I was on call, I was terrified because you have one senior attending, and if they get busy with something, it's all on you, and you're so worried about making the wrong decision. But if you double check everything that you do, speak to people who have more experience than you when you aren't sure about what to do, you're gonna be fine. While those nerves are totally normal and expected, there are ways to combat it by being informed, by being knowledgeable, and by being smart. I can relate to the feeling of like coming on call and instantly getting things to do. For me, my call started at 7 p.m. So when I would go in at 7 p.m., the team that's coming off would hand off to the pager to me and say, hey, we were so behind that there's still 3 or 4 admissions that are in the emergency room that need to be done and brought into the hospital. So you come in and you already have stuff to do. And then on top of that, you're getting pages about new things that are going on.
The attending thinks it was a pulmonary embolism. No way anyone could have caught it. Anyhow, you have to pronounce him.
Why didn't anybody page me?
Could you just pronounce him so I can go home?
Okay, so this is an interesting thing. Pronouncing someone dead is usually done by the on-call resident, so that's accurate. What happens is if a person dies in the hospital, the nurse pages the on-call resident. They have to do a full exam. We look at the pupillary response, pain threshold. We put a pen on the nail bed and we press very heavily. So if the patient is somehow not dead, they would wake up. We listen to the heart, we listen to the lungs for extended period of time. There's like this whole physical exam that we do. And then we write a long note calling the time of death, suspected cause of death. In addition to that, once you pronounce the patient, you have to talk to the family, which is a very difficult conversation. You mature very quickly during these moments.
Even now, when I finally get to go home, in the back of my head, I know the hospital's still here, wide awake.
That line is very true. There's been times like I was in a good mood to go home and I was like, let me just stroll through the ER, and something happened and I needed to help someone out, and I end up staying 3, 4, 5 hours past my shift. It's like one of those things, go home while you still can, because you need to be back here the next night to save lives.
The most important thing is that I got through my first 3 days without looking like a complete idiot.
Another episode of the Dr. React series is in the books. Mixed feelings on this one, and that's surprising because I thought I would find it really funny. There was definitely parts that had me laughing and I was like, yeah, that's so true. But I don't know, some parts were just so dark and mean-spirited that I couldn't get behind it. It pushes a lot of the stereotypes on the medical community that aren't good to be pushed, and we should be getting rid of them instead of celebrating them. I probably need to watch more episodes to truly understand what the characters are all about.
Oh my God, that's disgusting.
I already dosed him with morphine, and the x-ray says the nail went straight through, so it's not that big a deal. Oh dear God, she's getting woozy. Quickly show her the bloody side.
Look at that. Yeah. Oh. Touch the nail. You wanna touch it? Touch the nail. Touch my nail! Touch it! Lick the tip of my...
That's so mean, but it's true. Some people do have what we call a vasovagal reaction when they see blood. Their blood pressure drops, they faint temporarily. This is not a deadly condition, but the sight of blood, it's scary. It stimulates the part of your nervous system that makes you fear for your life. And to some people, if it gets overactivated, you can faint like that. When I was a medical student, I was doing a lot of ABGs, which is an arterial blood gas. You have to put the needle right into the radial artery. Unlike veins, you can't see the arteries, you have to feel them, which makes the procedure that much more difficult, but it's a high pressure system. So when you put the needle in, if you miss or the needle tip is not inserted properly, blood can start squirting out. One of my first few times doing that, I put the needle in, blood started squirting out, the patient fainted. Luckily they were laying in their bed, but they were so worried that they saw the sight of their own blood that they passed out.
Let's get you to a hand surgeon.
Tough guy.
Ow.
Somebody will get her.
So the reason why the ER doctor or the internal medicine doctor doesn't handle this complicated case of the nail going through the hand is because the hand is really complicated. That's why you need such a subspecialist. You don't just need a surgeon, not just a plastic surgeon, you need a hand surgeon. The hand has tendons, ligaments, bones, nerves, blood vessels, and they're all in such close proximity. If you don't know the anatomy inside and out and how it reacts to a nail going through it, you're gonna have a tough time. There's gonna be a higher rate of complications.
Wait, stop.
I'm guessing Mr. Weinberg is Jewish.
Yeah, so?
Why isn't he circumcised?
A recent medical study found that a mistake is made on about 20% of all patients. Most of these are clerical and harmless, but it still adds up to a lot of near misses.
Dr. Wen wants me to ask you if there could be a mix-up, because our appendicitis patient, that dude doesn't have an appendix.
Hospitals make mistakes. Patients, unfortunately, get ill as a result of a hospital complication. When you go to the hospital, if you notice that the doctors are trying to eagerly get you out and expedited as fast as possible to go home, the reason is not because we want you out, but it's because we want to lower the chances of you having a hospital complication.
You're pregnant.
I'm what now?
Yeah, I'm pregnant. Your fiance's gonna be so happy.
My fiance and I decided not to have sex until we were married.
So he's not gonna be so happy.
Curious?
Can't stop thinking about Mr. Weinberg's testicles.
Dude.
I mean, I almost removed one of them, Todd.
Which one?
Like it matters.
Oh, it matters.
Fun fact about testicles, one of the testicles usually hangs lower than the other. Some men get worried about that and actually come see me to make sure everything's okay, but that is a normal variant.
You're not pregnant. The lab tech just switched the samples.
You're killing me. Hey, sweetie, you know I was just joking about all that stuff, right?
Jesus. Samples can get switched up. This doesn't regularly happen, but we've talked about this on the past episode of Scrubs, that when hospitals are more ready to admit their mistakes and point out what they did wrong, apologize, tell the patients what the plan is gonna be so that they don't repeat the mistake, there's less likely to get sued. That's always important to keep in mind, even though that's just a totally hilarious scene.
So it turns out she wasn't really pregnant after all, because some idiot mislabeled her urine sample.
I was a heartbeat away from giving an appendix patient a crotch lobotomy.
Oh my
if I do my best and I lose a patient, you know what? I can live with that. But if a clerical error is the reason why a guy's walking around here with only the lonely, well, damn, that don't sit well with the big dog.
Well, that's why nowadays we do a timeout where we literally, before we start the operation, before the patient gets put under, we say the patient's name, we describe the procedure, we talk about the site of the surgery, we get the nurse to confirm, the doctor to confirm, so everybody's on the same page, which decreases the likelihood of making a mistake. Oh, and very important to note, while the patient's asleep and we're performing the surgery, the nurse that's in charge of assisting the doctor is counting all of the instruments, is counting how many gauze pads are being used, all of the rags, everything is counted before and after to make sure nothing gets left inside the patient, because this has happened before, and it's a horrible, horrible mistake.
I was paged because Ben's blood work was finally ready.
Unfortunately, the chart wasn't in the outbox.
I'd knock, but the hematopathologist is the meanest, intern-hatingest monster in this hospital.
It's funny because nowadays, all our results are on the computer, so as soon as we get results back, we just pop open a computer, all the results are there to review. If we have any questions, we can contact the pathologist or radiologist, whoever's running the test, to get more info, but computers have made this process a lot easier.
Come on, good news.
Hey, Bambi.
Couldn't quite catch that.
You okay?
Leukemia. No.
Leukemia is a form of blood cancer. It's been known to be a children's cancer, which is slightly incorrect because more adults get it. Essentially what you have is an increase in white blood cells, and this is an improper increase, and it's such a big increase that it pushes out the red blood cells, even the platelets. Platelets are the cells that clot, so if you have a cut, they're the ones that come in and fill that clot. So for example here, he has such a spike in his white blood cells that he's actually pushing out the platelets and he's unable to clot properly. That's why he's bleeding while shaving. He's bleeding out of his wound too much. And also something very commonly that happens when patients tell me is when they brush their teeth, there's an excessive amount of blood and it stays around for a while.
Oh, Janice. Are those the test results we've been waiting for?
Wait a sec. First Turk's patient, then Elliot's.
This is a mistake. I feel it in my gut. I'm sure of it.
Hello, Janice.
No, this is something. You know that lab is backed up again, and so I'm gonna, it's, a little while.
Actually, he's not wrong in doing that. When I have a patient who, I guess it's not the same as this situation, but let's say I have a patient who doesn't have any symptoms, and I order blood tests for a screening purpose, and something comes out horribly inaccurate, signaling a form of disease. My first job is to recheck that lab value to make sure that there wasn't a mistake, because that does happen. There's been times where I checked the red blood cell count of my patients and found them to be horribly anemic. It didn't make sense. It didn't fit their clinical symptoms. It didn't fit their vital signs. So I asked the lab to repeat the test, and voila, their labs were totally normal. So if you feel that the clinical presentation doesn't match what's on the blood, recheck it.
You know there's only one more person to talk to.
the hematopathologist.
Hello?
Call me Dr. Bob.
You go by your first name?
No, first name's Fred.
Fred? Bob?
What can I do you for?
Hi, I was hoping
love that
you could
interaction.
recheck Ben Sullivan's blood smear.
Well, that depends, young man. Do you actually think I made a mistake, or do you just wish I did?
I kind of wish you did.
Then I'll do it.
Sorry there, giant 70s security guard guy. Cold out here, huh?
Yes.
Where is his wound? He just had a nail go through his right hand.
Sweet take to be always working.
Being a lab nerd, that was a mistake. Whenever you put a slide onto a microscope, you have to use the lowest magnification possible so that you don't put the high magnification on and then end up breaking the slide.
Let's try this again. Are those the test results?
Yeah. Ben, you have leukemia.
Well, that sucks.
Yeah.
As much as they try to make light of the situation, I think the way that he delivered that news is actually ideal. When you're straightforward and honest and quick to the point, that's the best way of delivering bad news. You have to understand what a patient is going through. You have to give them time to process it. If you feel that they need some more information or reassurance, you can give that to them. But I like to hold out and ask them what questions they have. And understand that when you're delivering bad news, a lot of it is not gonna stick, especially the dense information like about treatment options, this, that. You have to let the patient process it. Just give them a little piece of information and then just be there for them. They can scream, they can yell, they can be quiet. Everyone has different reactions depending on their personality, and it's not an easy situation. This also hits home for me because unfortunately I lost my mom while in medical school to leukemia, a form of leukemia known as CLL. Delivering this type of news is something I have to do often. It's a tough situation all around, but if you can be straightforward, you can be honest and really care, and even cry, that's okay. A lot of doctors think they have to be unemotional and not cry. If you feel that to cry, cry. You're human, that's okay.
Before I settled on the outfit for my first date with Kylie, I had to run it by the experts.
So be honest, but not too honest, okay? Because I'm feeling a little chunky.
My man is wearing a red t-shirt underneath a white dress shirt, untucked with a blazer on top. He's like combining 3 styles, maybe 4 into one. It's a solid no for me.
Whoa!
Short sleeve shirt under a blazer. Why? Oh!
Happy birthday, Laverne.
Thanks, Carla. Did you?
Oh!
Happy birthday.
Shirt under a blazer. Why? Oh!
Happy birthday, Laverne.
Thanks, Carla. Did your brother make you face cake? Sure did.
Wow. I think I can have a piece of that face cake.
I heard those face cake.
Face cake, I heard it.
I don't know since what it... I think I can have a piece of that face cake.
I heard those face cake.
Face cake, I heard it.
I don't know what it is with hospitals. We love bringing unhealthy treats and snacks to our staff lounges. I don't get it. Like, I know we probably stress eat more than most professions, but the fact that we have the unhealthiest stuff when we're supposed to be examples of health. We do it sometimes in good camaraderie to celebrate birthdays, but then there's like a birthday every other day, which means Philly fluff. If you don't know what a Philly fluff cake is, you're missing out. And you're probably healthy.
Thanks for the shirt, Lonnie.
I don't know what a Philly fluff cake is, you're missing out. And you're probably healthy.
Thanks for the shirt, Lonnie.
Are you doing this because I forgot to shave this morning?
What is going on? Why is he wearing the name tag on his nip?
So, what's wrong with this guy?
Well, let's see. Fatigue, fever, malaise. Have you been to Hong Kong, sir?
I don't know if this is going in a medically accurate direction. And on top of it, who's gonna take up a patient's chart and just start reading it with a random non-hospital employee? Although maybe she works in a hospital, I don't know. And gone are the days of the chart sitting at the patient's bedside. Because people walk around there and health information is a protected asset.
Could be SARS.
Severe acute respiratory syndrome. And now, with COVID-19, we're facing SARS-CoV-2. In the beginning, actually, when the International Taxonomy of Viruses, the organization that names all the viruses, named it SARS-CoV-2. I was so confused why they chose to go with that instead of COVID-19, and then it hit me. COVID-19 was actually the name of the disease caused by SARS-CoV-2, and SARS-CoV-2 actually has a meaning of SARS coronavirus 2, because it was the second one after the initial SARS.
Doctor suspects SARS. It's caused from immediate quarantine lockdown.
But why did he suspect SARS? I mean, the patient had what? Fatigue, malaise, basically not feeling good, and like a fever or something. That fits 10,000, if not 100,000 different illnesses. And FYI, when we do isolations or quarantines, that's not how we do them. We don't have metal doors dropping and alarms ringing like that. It's a lot more controlled. It's a lot smarter because different illnesses require different types of precaution. Initially with COVID-19, we were doing just droplet and contact precaution. But then as we became worried about aerosolized particles, some hospitals went to airborne precautions. That required a negative pressure air room for patients who were admitted with the illness. That's why it was very difficult on hospitals to manage all these patients. It's a novel virus. We were learning as we went. Like imagine, normally we're treating patients with already existing knowledge of an illness. Now we were treating patients and learning at the same time. It's not an ideal scenario for ideal outcomes.
What have you done, Nobi?
Quarantinis, anyone?
She said quarantinis. That's funny.
Unfortunately, by hospital policy, we have to stay locked down until the labs come back, and that's going to take several hours. So let's hang in there and not forget this is all Dr. Dorian's fault.
We are short-handed. There are only 4 doctors here.
I counted more than that.
I'm talking legitimate doctors, Turtlehead. Here, P-Pants is a pathologist, so he doesn't count. Johnson is a dermatologist, which is Greek for fake doctor, and...
Oh my God, he's a dermatologist is Greek for fake doctor. I can only imagine how a dermatologist or pathologist feels when they're on an airplane and someone says, is there a doctor on board, and they volunteer. There's no way they know what to do unless they're fresh out of residency and they just got some training. But otherwise, like if you're seeing skin conditions all the time or you're looking at slides, how do you know how to handle anaphylaxis in the air without a EpiPen or an Epi auto-injector? By the way, we're gonna have a dermatologist on very soon, and not to critique my horrible SPF situation here. Please don't judge me. I know it's embarrassing. I didn't apply the SPF correctly. I don't know how I did it so poorly, but look at this.
I'm bored.
I don't know how I did it so poorly, but look at this.
I'm bored.
I'm a surgeon and there's no surgery.
Why do you think I brought you in here?
Oh my God, that rhythm on the monitor. I don't understand. They have all of this equipment. They have medical aids. But what is going on their monitors? The rhythms that are being shown looks like the patient is literally coding as we speak. I don't understand. Just show a proper rhythm.
The only thing I detest more than treating patients is treating patients on an empty stomach. I'm famished.
You've been in here for 8 minutes.
I haven't eaten since yesterday. I've been starving myself because I was going to a steakhouse tonight. It was just going to be me, a 24-ounce porterhouse, and a fistful of blood thinners.
This is like the exact opposite of the chief of family medicine that I worked with. Well, he's technically the family medicine program director, Dr. Joseph Tribuna. He will starve himself for 10 days if he has to in order to make sure his patients are taken care of. I have never seen an attending who during rounds will not only make sure that they're getting the diagnosis right, the patient's taken care of, all of that, but then also he would literally open a patient's food for them, help them eat it. Like no job was too big or too small to make sure that the patient was comfortable. Whoa.
So how's it going with Kylie?
To make sure that the patient was comfortable. Whoa.
So how's it going with Kylie?
There was nothing exciting going on.
This sucks. I need to look like a stud, and a doctor can't look like a stud unless he's saving somebody's life. I need someone to have a heart attack.
Got $20?
Come on, Steve. Stay with me, buddy. You're not getting this one.
Oh my God. What are you doing? I mean, I know it's fake, but it's too fake. It's a fake within a fake. It's a show that's poorly medically acted on top of a fake person having a fake heart attack. Okay, there's too many fakes.
Could you make your face a little bit redder, buddy? Come on.
I want more money.
What?
$50 or I tell the girl.
I don't have it.
Get it.
Ellie, I need another doctor over here. Stat.
He said I need another doctor. Stat.
Give me $30.
I gave you 20 on tapped. Ask Johnson, he's loaded.
I need a dermatologist over here. Stat.
My my God, these chest compressions are so bad.
Time to shine.
What do you need? Is it a rash? Look, I think this guy take a heart attack. He wants $50. We only have 20. You know, I feel like you guys just use me for my money. You have a trust fund. Now give me the money.
Clear! I'm alive!
Stop shocking people whose hearts are beating normally, please. This happens too often on these shows, at least it's comedic here. And by the way, with this heart attack, if someone has a heart attack, you don't just run and start doing chest compressions if they're breathing and have a pulse. The chest compressions are when for a heart stops. Literally, so the heart's not beating, you're doing chest compressions to simulate a heartbeat. Like, even if you do chest compressions perfectly, you're still only moving the blood, circulating the blood at about 20% of the efficiency that the heart would do it normally. So no, if someone has a heart attack, you don't just start doing chest compressions, and you certainly don't just shock them out of nowhere. The main thing you wanna do when someone's having a heart attack is to open up their arteries that are currently blocked. And there's multiple ways we do it, stents, there's procedures, medications, and a lot of the times it's very time sensitive. Actually, there's something known as door to balloon time, which is like when you come in with the first signs of a heart attack, we know we have to get you in that cath lab to open up your blocked artery, or otherwise cardiac tissue is gonna die and some of the damage could be permanent.
Seeing you in your element today, you seem so
Here it comes. Sexy.
genuine.
She would have said sexy if I had a mustache.
You know, James lied all the time, and I don't know. It's just nice to be with a guy I can trust.
Trust is the foundation of any good relationship, spousal or otherwise, work or otherwise, friendship or otherwise, doctor or patient or otherwise. I don't have any more.
Laverne, I bet you're tempted to break open that face cake and just tear it apart.
No one's touching this.
Oh, I don't care. I'm not even hungry.
Why is it called face cake?
Why is it called face? Someone explain it to me.
Hi, Glenn.
Hey, I'm Glenn. I'm Glenn. Look, let's not go down that road again.
Why is his ID like floating on his chest? Do you guys see that?
I don't understand why Carl didn't.
Like floating on his chest. Do you guys see that?
I don't understand why Carl didn't tell me about you guys.
Is it just me, or in Scrubs they always have conversations over patients that are comatose? Just go into a meeting room. There's so many empty rooms. Why do you have to do it over a patient's body?
The lab results are back and there is no SARS. The quarantine is over.
I just want to know why they thought it was SARS in the first place. Why did they have to quarantine the entire department? Why didn't they just do a flu swab and a respiratory panel right away? Get some quick results, find out that it's RSV, and just go about their merry way. Instead, they order a complicated test that takes... All right, it's a show, I get it.
Hey, Dr. Cox, what are you doing for lunch?
Not having it with you, Paula. Lunch for us, not going to happen. Normally, I'd tell you something harsh right about now, like, we're not friends, but then you'll just grin that stupid grin and shake your head back and forth, like, how could that possibly be true?
I think attendings eat with residents, and usually, as long as the attending is normal, they offer to treat the resident, given the fact that they have a much higher salary than the residents.
Some doctors like to change into their streets when they go out for lunch. Not me. I like how the world reacts to me as a doctor.
I frequently wear my scrubs out because they're not like surgical scrubs, meaning they don't need to be disinfected. And I don't operate, so I don't have like blood splatters, which would be biohazardous material to wear out into the real world. So that's why it's important to delineate between the two types of scrubs.
Hey, it looks like somebody else is sick of that cafeteria stuff, huh?
Oh, no, what the hell? Did you follow me here?
Why is he holding a jar of pickles?
Hey, wanna go splitsies on some deli counter meatloaf? I can't finish a whole serving. I mean, I can, but I don't like to. It all goes right here.
To his liver? What was he pointing to?
Guys!
Yes, it could be more of a nightmare. Sad, yes, but this did not change the fact that she was unbelievably annoying.
Oh my God, what are you doing here?
You gotta just keep moving. You say hi, you make a little eye contact, keep moving.
So, you guys wanna grab some lunch?
Oh, we have to get back to the hospital.
I'm all right.
You know what, Nobi, stay. Have lunch.
I should probably go too. How are things?
You know that's stealing.
Oh, come on, Rebecca. Everybody's doing it.
What are you gonna do? Arrest him for taking a single pretzel?
Today was a busy day at Sacred Heart. We had 3 separate patients waiting for transplants, and we were doing everything we could to keep them alive while we could locate donors.
Whenever someone's organ is failing and you're trying to keep them alive, you essentially try to create an artificial form of whatever that process is. But then also you have to think about the negative repercussions of an organ failing. So with the liver, for example, you have toxic substances building up. With the heart, you gotta give blood, you gotta give fluids, you gotta make sure that you're having good fluid release in the sense of giving patients diuretics so fluid doesn't build up in their lungs when their heart is failing.
So now, Davy boy, I promise you we're gonna find you a kidney. I would literally swear on my father's grave, but whenever I go there, I usually just end up dancing on it.
What?
So am I ever getting out of here?
We haven't found you a kidney yet, but I have some ideas.
I'm just curious why that patient can't be on dialysis. Like they could put a port in, he can go Monday, Wednesday, Friday dialysis, which is like basically having a kidney, not one-to-one replacement, but pretty good.
Dude, what the hell are you doing?
Having lunch. Cafeteria stinks and I can't go to the grocery store because apparently crazy Jill Tracy lives there. Every time I try and shop, she follows me around like I'm her only friend in the world. It's pathetic.
So he's having lunch by giving himself an IV bag of salt water? That's not enough nutrients in there.
Dr. Dorian, can you help me?
Sure, what's going on?
She was admitted a short time ago and she hasn't regained consciousness. Toxrin's positive for cocaine. Do you think she could have OD'd?
Why are they asking this question now? I feel like all of this is happening very out of order.
She had been stood up on a couple dates, and she hadn't seen her shrink in a while. He was definitely depressed.
Is he becoming truly emotional there, or is that jokingly?
Sincere.
From where it went to where it is now, he went full sincere?
Well, because that's the woman he was having lunch with from the grocery store.
Yeah, that he hates, and he called her all sorts of names.
And with organ transplants, if there's good news for one doctor,
People, I've got organs.
it probably means bad news for another.
You can use her organs.
This is a good time to recommend that everyone become an organ donor. Very important. You pass on the gift of life to others.
Just tell me this. Is there anything anyone could have done?
No.
I mean, she's asking medically.
Unless you mean me.
The hard part about treating patients with mental health conditions is that in many times you don't have full control, let alone do they have full control of their current mental health states. And what you can do as a provider is make sure the patient has access, make sure a patient has a crisis plan, you're taking the best possible steps to protect themselves. Can you ever 100% prevent calamity? No, it's impossible. That's why it's very important that doctors recognize that and don't beat themselves up over situations just like this.
It's amazing how quickly people improve once they get a new organ. Whether it's Mrs. Sykes with her new liver, Mr. Dennison with his new heart valve.
That's not always the case. People don't always recover very quickly. It depends on how long they were without a functioning organ, what complications did they have. And like with heart valves now, we do something called TAVRs, where you literally go into an artery and go into the heart and do a valve replacement that way. Not everyone's a candidate. Open valve replacements happen as well too, but it's a pretty interesting procedure these days.
Or Dave.